In a very basic form, procurement and supply chain management is any process which we use on our day-to-day life to ensure that we have the basic commodities available. For example, when you decide what to buy for your breakfast or for your lunch or for dinner, you're following the procurement and supply chain management process because you are taking decisions among various options, what you need. You are making decisions based on what is there in your fridge or on your shelf, and you are making a decision based on what you think is the best quality, so which is a quality process. And then you are also making this decision based on the money available to you. When it comes to systems like health, for education, water and sanitation, or nutrition, all these programs or all these work requires significant investments in ensuring the availability, affordability, and quality of commodities to provide services to the patient. So that is the key outcome which procurement and supply chain management system is supposed to ensure. Procurement and supply chain management has various components which works around the complete policy cycle of OPM. If we can look at it from two sides. One is at the side of the business and second is from the policy cycle. From the side of the business, the key verticals in which OPM operates are governance, health financing, research and statistical teams. So there are strong linkages of procurement and supply chain management with each of the vertical we operate in. While our policy cycle defines the process in which we approach each of the work. So as we go along the research cycle, which starts from the identifying the issues, developing policy options to address those issues, implementing those options, and so on, and then monitoring and evaluating. Same thing, same process is also applicable for the PSM or logistics. So in Nigeria, where earlier there were 20 to 30,000 patients maximum accessing services from the government system, it has increased to 6 to 7 million patients per year, which you can expect how many lives it is saving. Which is then the commodities there in the facilities are more than 50% economical as compared to the private sector, which has improved the affordability and access to the services for the poor patient, resulting into saving of lives because they are now buying the facility. And it has also on its own regulating the prices in the private sector because the prices in private sector has also gone down over the period of 3 years we track the prices. So overall the patients have benefited so much that we can safely assume in the last 8 to 10 years of this thing being done that not less than 50 to 60 million patients have benefited, and if we can convert even at the 10% of the lives saved, we're talking about 5 to 6 million lives saved.